If I can tie a laptop onto a treetop and then ask the IT guy to climb up and code and come back down and do something else, that would be fun. Our IT professionals face a huge amount of issues with their neck, with their lower back, predominantly because they sit for long hours. So what causes injury to them? Too much sitting. Walking is the most overprescribed, most ineffective activity there is. Brush your teeth with your left hand. Wash your face with your left hand. Tell me, why did dentistry get off medical college? Have good sex. That helps posture.
Welcome to the Scrub Guru podcast.
Scrub Guru podcast. I like it. I like it.
Yeah.
I like it.
So, as always, let's get to talk something interesting about the lovely work that you do.
Okay.
I've always been fascinated because, as a sportsman, I was a tennis player, and it kind of movement, mobility, fitness, injury,
Performance.
and performance, um, agility, stability, footwork, all of this is a part of my growing up. So that uh, the kind of precision or the kind of meditativeness it takes to be a professional sportsman, I totally get that. What has always intrigued me is, a lot of us get injuries, and then we've also seen the way people used to assess professionals playing, and even before we enter professional sports, people would look at us and say whether you are even having the DNA,
The qualities
the
to make.
qualities to be, and one
Sure.
of that is your own body, right?
Sure.
And so most importantly was posture for everything, right? Suppose if I have to hit a forehand, if I have to play a backhand, if I have to serve, so your posture becomes extremely important. And I'd like to understand from you, and for the benefit of all our listeners or people who are watching us, is what is posture?
That's a good question. Posture, purely defined, is a position that the body takes or the body makes in order to accomplish a task. Posture primarily has been dealt as a static consideration, like when you're standing, are you standing tall? Are you standing upright? Is your head up? Is your chest out? That's a very militaristic approach to posture. But posture over the years has also evolved to, are you sitting better? Are you walking better? Are you standing better? Posture also takes on a little, takes on an interesting view on a production line in a factory. The workers who are fixing an engine, or workers who are fiddling with a spanner, they are all positioning themselves to for an activity to make it as effective and efficacious as possible. On a day-to-day life, posture plays an important role, primarily because it puts the body in the most effective position to accomplish a task. That's what posture is and has evolved into.
So, uh, what comes to my mind is there is this human body we're all born with,
Correct.
and then we perform different duties.
Sure.
Let's say today I'm a dentist, right? Somebody else is a farmer.
Sure.
Somebody else is putting up signage boards,
Sure.
right?
Sure.
And they all do, and somebody is a musician, let's say a violinist. But I always get confused between what is normal and what is abnormal or what is extreme. because we also know in medicine that there are certain things which we would classify them as abnormal. This is
Sure.
not normal.
Sure.
Like if somebody is standing, their feet should be grounded evenly on the ground and stuff like that. So, could you elaborate a little bit more on how our bodies adapt to certain work and certain lifestyle?
Sure. Sure.
And also, is it good, or are there certain things that we must truly avoid to screw up a posture which is quote unquote ideal?
Look, there are quite a few questions in that question. Now, let me try and see if I can eke out each of those questions and answer them. Professional postures have become more and more interesting and more um, invasive into people's lives, as opposed to postures that really didn't matter so much early on. For example, let's start with kids, and I'll take you through different professions, and we can perhaps pick out a profession and expand that if necessary. Let's take school kids. School kids that carry large amounts of books on their back tend to have postural issues, primarily because the bag is sagging them, pulling them at the back. They tend to have lordotic issues. They tend to have cervical issues. They tend to have poor pelvic position because they are carrying bags to school on a daily basis. Let's check out another profession, auto drivers. We pay our auto drivers, bus drivers, policemen and women who do considerable work either driving or standing. Because of the way the engine is positioned in an auto, because of the way the height of the windscreen is in an auto, a lot of the auto drivers can't see the road if they actually sit straight and drive. So they will have to bend their body in order to see the road. A lot of bus drivers face issues with their posture because of how the clutch is and how the gear is and where the seat is positioned to the steering wheel. A lot of professional taxi drivers face lower back issues because bucket seats promote poor posture of the spine. You are a dentist, and doing an RCT or working long hours on a patient in their oral cavity is a very strenuous task for both your lower back, neck, wrist, fingers, so on and so forth. Primarily because you can't necessarily look into an oral cavity with your pure eyes. You have to have that mirror that you guys use. There are some surgeons who do general surgeries like appendicitis or a hernia operation. So they have a positional stance to access certain areas, and that's all they can do. They can't access it any other way other than stand that particular way. In order to avoid a patient's hand coming into the center, they actually push their hands, abduct their hands out so that they can stand within that space. And they're usually leaning over the patient. So they're usually, because they're all right-handed or predominantly right-handed, and you can access that area better, you will stand on the right side, lean on the right side, operate from the right side. And that if you do 4, 5, 6 operations a day, that tends to become your positional posture. And then you're tired, then you go and sit. So really, the left side never really gets used. There are those. Now, all of these, because we are doing a lot more of these days than what we were used to, we are now becoming more and more posturally poor post our work than we used to be. IT professionals included, long hours of sitting. depending on where their laptop is or where their computer system is or how old their chairs are. I have seen people using the same chair that is tilted to one side for years because it just positions them to their laptop in exactly the manner in which they would prefer to sit. So, a chair that was bought 10 years ago is no longer a valid chair today because the chair itself has gone through a postural structural change because you have only been sitting on one side. So those are some, so that's where postural issues tend to creep from the fact that you're doing the same kind of repetitive job every day. Posture also requires some amount of variety in life. So a farmer is perhaps best positioned to have perhaps the best posture because he would have to dig or she would have to dig, they would have to plow the land, they would have to pick up the hay, they would have to do physical stuff. But most of us otherwise tend to become very biased towards a functional posture. What serves our job the best?
Interesting. So, why do people get injuries? Like I've seen so many people saying I have repetitive stress injury or repetitive strain injury, especially among IT professionals, wherein people are working on the desks and stuff like that. So, why is it that our body does not adapt to that, or is it a false positive assessment of us? Because if you're saying farmers do so much amount of labor, they also must be going through something. Is it that we haven't studied them enough, or is it that everybody goes through pain of an altered posture, or is it that some bodies are just made that way not to go through? Fundamentally, why are people vulnerable? Which category of people are vulnerable to postural problems?
I think we all are. There isn't a soul who is not vulnerable to poor posture or problems arising from poor posture. The farmer gets away with it because I think they have variety in their lives. They have variety of movements in their life. There is a squat, there is a climb, there is a lunge, there is a throw, there is um, there is a bending, there is a straightening activity. So, farmer does innumerable number of movements in a given day. I don't think I would do that in a given day in my line of work. I don't think you would do that in your day, given your line of work. So, the fact that we hone into a very limited range of movement pattern and repeat that pattern time and time and time again is what gets us to trouble. We also should recognize that if by doing an hour's worth of activity for preparing for a 10 hours worth of activity, such as I went to the gym for an hour and I'm going to sit and work for 10 hours. Lovely that you have the discipline of going for an hour to the gym, but that's not going to cut it. That's not enough to do 1 hour for a 10-hour seated job. Our body was never designed to do a particular task for any length of time. For example, if you were to sit in Vajrasana or if you were to sit cross-legged, you can only sit for so long. You can't sit upright all the time. It is humanly impossible to sit upright all the time because the structure doesn't allow for it. And interestingly enough, what people don't recognize is not all your muscles are working all the time to hold you in one position. Muscles also need rest. So, they also take turns to work. And because of that, they can hold a posture for some time. And because muscular insertions and origins are different, their pulls are different. How they pull on the body is different. So now you're using a muscle that is not used to pulling in that angle, but you have to ask it to pull in that angle. That muscle is going to fatigue out. So before you know, the joints will misalign or malalign. Hence, you create this problem. I think the trick is really to add variety into life. If I can tie a laptop onto a treetop and then ask the IT guy to climb up and code and come back down and do something else, that would be fun. But
So
yeah,
basically, the takeaway is that your fitness levels are not going to improve significantly just because you are disciplined enough to go to a gym or any sort of exercise routine 1 hour in a day. You have to be doing a range of movements or activities throughout the day so that different muscles and different joints are kind of stimulated throughout the
sure,
day
sure,
so that they are all functioning well.
sure. Because movement, it is intelligence, right? Movement has or requires intelligence. And therefore, you need to use different movement patterns to engage different intelligences to be able to live a fairly good, active, healthy life.
That brings me to another aspect of um, injury. So, when do people get injuries? And well, broadly, we all understand that if you are kind of stretching yourself beyond a certain limit of your physical ability, then it causes an injury. I'm just putting a very broad statement. Um, but we also see that if 5 people are doing the same activity, each one of them has a different level of endurance and a different sort of experience and pain that they may go through at the end of that activity. What is that single most important thing that determines who will get an injury versus who will not?
Well, that's a complex question, man. Um, there is no one single determinant. So let's start there. If I were to take, let's look at. Okay, let's do this. Posture is predominantly a product of a few things. One, how long are your arms? How long are your bones? So leverage. The longer the lever, the harder to maintain posture. So tall people tend to have issues with their posture because of lever, long lever. Someone, let's say in your field of dentistry, if your vision is not great, that is your eyesight is not great, the chances are you will lean into the mirror a lot more. What is that mirror called? Mouth mirror. You lean into that mouth mirror a lot more than you would if your vision was good. I'll give you another one. If you're diabetic and you have incurred a hearing loss or a loss of hearing, even by a little bit, and you're in a board meeting and people in the board meeting are talking softer, would that person lean forward or not? Because of their ability to hear less, their tendency to lean forward is all the more available to them posturally. So now, does hearing loss cause postural issues? To an extent. I'll give you another example. People who wear bifocal lenses, right? Clearly, what they see on top of the bifocal, on top of the magnifying lens, is very different to how they see at the bottom of that lens because of the bifocalness of the glass itself. No matter how graded and fine that change is, you will see a difference. There is a perceptible difference. So, how do people with bifocal lens sit or see? Their glasses sit at the nose tip and they usually are chin up because they want to see there. Has that changed their posture? Of course it has. Are they prone to more neck issues? Generally speaking. So you begin to see how these different senses begin to contribute to how you will position yourself. If you can't hear me with both ears, you will assume a better ear to hear me. So you will prop yourself up in that manner.
So, in that case, are you saying that persons with disability will have more physical issues or postural issues, pains, and all of that?
Some of them do. Um, some of them do. Yeah. Yeah. People who swim with one hand, whereas the other side does not get used at all because they don't have a hand there or an arm there. Um, there's a huge loss of musculature on the side that has no arm. They're very well built on one side, not so well built on the other. So there is a muscular imbalance which causes a postural imbalance. Sure.
Like I've seen so many people walking, right?
Sure.
They're uh, they're young people, may have some sort of a disability wherein one of their leg isn't meeting at the
You mean the
same.
length is not the same?
Well, it could be length, but I've seen a lot of ankle deformities, some
Sure.
people with
Sure.
knee
Sure.
deformities or hip
Sure.
deformities who probably are not even having the right balance posture. They're grossly, not just grossly, but visibly deformed, and they kind of struggle to walk. But then I've seen them doing this for years together. So, is there a way that, are you saying that such people will for sure suffer from issues? If so, if it is true, then is there a way that our body also adapts
Sure.
to a certain sort
Oh
of
yeah.
disability?
Oh yeah. Your skeletal is not a one-time issue. It's not a static skeleton. Your skeleton changes over a course of your lifetime. Your skeleton bends, your skeleton becomes impinged, your joints become impinged over a period of your life. So people who tend to use one side more than the other because that side functions better will tend to have structural changes evolved into their posture. So they may be more left dominant because they're left sided, because that's the only arm they have, or the left hip moves in a particular way because the right leg is short. So therefore, no matter, even if you put the corrective shoes, the hip still articulates that way on the left. So there are those issues. Of course it changes. And it changes for everybody, whether you're disabled or not disabled.
Then what causes an injury?
An injury has many factors to it. One of the predominant causes of an injury, let's take static injuries, injuries that happen because you are predominantly static, seating. Our IT professionals face a huge amount of issues with their neck, with their lower back, predominantly because they sit for long hours. So what causes injury to them? Too much sitting, which therefore changes their skeletal structure. When I say it changes their skeletal structure, it doesn't mean they had 12 ribs, now they only have 11 ribs. That's not how it changes.
Yeah.
We take, let's take a policeman who mans the road. He's a traffic cop. And if a traffic cop is is doing a traffic junction all day, all time, and the traffic is only heavy on the right side, not so heavy on the left side, the chances are that he will end up having some amount of issues on the right neck, right shoulder, because he's using that more. And it's the same thing in dentistry, same thing in orthopedics, neurosurgeons, general surgeons, cardiac surgeons, because they all address a particular part of the body in a particular manner. So therefore, they will end up having postural changes. And because of those postural changes, the body tends to have a chronic issue. It doesn't have an acute injury issue, it has a chronic injury issue, which is tightness of this musculature, joint spaces becoming less and less, articulation, range of joint movement becoming rigid or less full, less complete. Musicians have the same thing. They seem to have neck and lower back issues predominantly because how much voice output they should give, how do they sit, what do they need to do in order to throw voice out. All of those things contribute to this chronicness or the chronic nature of these problems. It's not acute injury. Sure, but it's very available to them, so to speak. That's how injuries begin to creep up in your system. It's not that you fell and had it. In most instances, such as sport injuries, which are predominantly injuries of impact or contact, and they only form about 2% of the injuries. Your impact injuries in football are negligible. However, your ACL injuries, which are predominantly non-impact, some may be impact, but predominantly non-impact, are caused without impact, and they are caused primarily because of timing. That is the neural input and muscular activity synced or not synced?
Got it.
So those are more injuries that happen because of timing. And if you were to scratch a little, yes, some amount of postural integrity would be there, but it wouldn't necessarily be that.
So what would you define as good posture?
If you're standing, if you can bear weight on each leg, 50% on each leg, that's a good start. Not tending to stand on one leg over the other. That's a good start. If you're walking, if you can negate the waddle, the penguin walk, side to side walk, if you can encourage more frontal walk, walking forward, that's a good posture. If you can keep your center of mass within your base of support, which is center of mass within the two set of feet or a pair of feet position, that's a good posture. Statically, it's easy to explain what posture is because everyone can see. Movement wise, it's difficult to explain posture because there is complexity in itself. So the easiest way to look at posture is if I can stand on both of my feet, 50% weight bearing on each feet. If my weight can fall in front of the ankle, if my hip is right above the foot, if my shoulder is above the hip, if my ear is above the shoulder, then I'm in a fairly decent posture without necessarily flaring the chest out, pushing your chin up in that sense. I would say that would be good posture. Something that you can hold for a good 15-20 minutes without feeling fatigued, annoyed, or tight anywhere.
So bad posture causes imbalance also.
Of course it does.
Or does imbalance cause bad posture? Both ways.
Yeah.
So I have another question. Like I know you're trained in Australia and you've studied human movement biomechanics, which is the science of how human beings move, right? And I've seen a lot of people who necessarily need not be with the same science or background as yours, but quote unquote people who help people with injuries, pain, postural issues, and all of that. I have seen that there is a huge difference between your approach and somebody else's approach. Um, it's to me, it's a very fair question to ask because you are the best person to answer this. Is I'm sure you have observed that too, because you would have seen a lot of people coming to you after visiting XYZ kind of people, and then I've heard it from a lot of your patients as well that his approach is dramatically different. And why do you think there is that gap?
Predominantly because I try not to look at an injury as a pathology. I try and look at an injury as a what is possible to work with as opposed to what is not available to work with. I think many a times when we diagnose people or look at people or begin to treat people, we are constantly thinking of what is the pathology, what is the treatment for the pathology, or what is the diagnosis, what's the treatment for the diagnosis, as opposed to thinking, in my line of work, we are looking at predominantly movement. If this movement doesn't happen, some other movement is bound to happen. So now I'm curious as to what movement is available for me to work with. If I can begin to look at the possibility of movement that's available, I'd rather work with that possibility and figure out a way to address the not possible. So I don't necessarily come with the bias of a diagnosis. To me, an osteoarthritic knee is not an osteoarthritic knee other than what it serves in understanding what is osteoarthritis. But the fact that the knee has flexion, it has extension, it has some amount of internal rotation, some amount of external rotation is great. And do I have access to the hip? Do I have access to the ankle? Oh, if I do, great. Now I can work with the knee. So now I'm beginning to think more laterally, more from a what is possible than what is not possible. That would be, I would think, the approach difference. But I look at movement possibility because I'm a movement specialist, so to speak.
So I forever have had this question that somebody has an injury. Injury is painful. And then obviously one of the main lines of treatment for most injuries, let's say, is physiotherapy. But but is that not causing more injury? Like how does movement at a time where there is already pain or discomfort help in restoring back normal function?
If you really look at how an injury occurred, it occurred because of a movement. Poor movement causes injury. Good movement enhances performance. So now the question really is, what is a good movement? Number one. Number two, many a times when we work with people, we are working predominantly from a symptom perspective. You have pain in the knee, I will treat the knee. Unfortunately, body does not work that way, neither does movement. Flexion in the knee is not bereft of some activity in the hip or some activity in the ankle. It has those activities. If I were to just flex the knee, I'm doing several body parts of mine are already working. My hip flexors are working to hold it, my hamstrings are helping it, my quads are helping it, my glute is helping it in a different way. So I'm anyway working multiple joints. So therefore, looking at a symptom and addressing the symptom provides for a futile end result, number one. Number two, for a movement to happen, it must have a plan. Movement does not happen arbitrarily. For example, if you did not know how to click a camera, I would have to teach you how to click a camera. If you did not know how to use an iPhone, I would have to teach you how to use an iPhone. If you did not know the swipe was available, a learning of the swipe is necessary. And So when we learn a movement, we have a cortex in our brain called the motor cortex, which helps plan and execute movement. It becomes automated because we do it so often, and we do it so often well enough, so it becomes automated. If somebody were to show you their oral cavity and ask you to treat, let's say, a cavity, you wouldn't have to think twice to how to treat a cavity. You wouldn't have to ask for an equipment. You wouldn't have to think of, oh, how do I hold this equipment? It just comes naturally to you. I can blindfold you and you'd still be doing it. Why is that? Because there is a motor cortex in your brain that has planned a movement and executed that movement, and therefore that movement pattern is imprinted. Now suddenly, if after an injury that movement, so that movement pattern, by using that movement pattern is what has caused this particular problem. When you look at and treat people, you also have to address that motor cortex. You have to rewire that movement pattern. Otherwise, they will go back to doing the same movement pattern that they did before they came to see you. So in a way, our approach should also be to look at how do I rewrite a program and unwrite its original program. Hence that approach works.
So, would you still go ahead and see patients with acute injuries, and or would you allow some healing time to happen and then start off with therapies, or is it advisable to do therapies even when they are in pain?
First of all, if you understand why there is an acute injury, you can actually start working with them earlier. For example, someone who has come in with a acute ACL has happened yesterday, and they have come in for a consult. Sure, an operation is necessitated, sure it will happen at some point in time, but we usually take about 6 weeks before we operate on them. And those 6 weeks are predominantly to build movement functionality, both in the joint that is injured, that is the ACL, the joint that has been injured, and two, also train the unaffected leg, because the benefit of training the unaffected leg actually lies in helping the affected leg recover faster. So it depends. Sometimes we give them rest, and sometimes we give them active rest. So they will have to actively do icing or some amount of mobility just to keep the joint going, as opposed to completely resting it.
That's interesting, actually. So, I'm thinking, correct me if I'm wrong, that if suppose somebody has an injured right leg, genuinely may require rest, but there's a transfer of load that happens onto the left leg now.
Sure.
Because they have to use it more.
Sure.
So, you're saying that it is better to strengthen and make sure that your left leg doesn't get injured because of the overload.
That's partly true. The other interesting part is if you do it in front of a mirror and you don't see your affected leg, you only see the unaffected leg working in the mirror. Brain is an interesting organ. It has the ability to stimulate the affected leg because it constantly cross connects in the head. So therefore, you will have some amount of stimulus to affect the injured leg, even though you haven't worked it at all.
So, you're also connecting the fact that there is a huge role of our mind.
Oh yeah,
on physical injuries and recovery.
absolutely. Absolutely. A mindful movement will lead you to lesser injuries than an unmindful movement. Absolutely.
Also in recovery.
Absolutely.
I don't know if you are aware of it, but do you think animals also get postural problems? If they're not,
Unlikely.
unlikely, right?
Unlikely. Unlikely. I've never seen a tiger with scoliosis.
So, what are humans supposed to do? Like, forget
Move.
about our professions.
Move.
Just move.
Move. Move a lot. Move in different ways. But move. Physically move.
So is walking good enough?
No. No. Walking is the most overprescribed, most ineffective activity there is.
Hmm. So what would you recommend for all of us to have good posture? Or I don't know if I should use the word good posture, but at least a stable posture, because it looks like from what we are talking that all of us at some point in our life will go through
Sure.
a postural
Sure.
issue which will
Or an
cause
issue that has been caused by a
by
posture.
bad
By
posture,
posture.
because
Yeah.
by the way of our profession and work
Sure.
and the adaptation, the
Yeah, yeah.
time length is too short for us
Yeah.
to actually adapt.
Correct.
So we end up having
We maladapt.
correct.
Correct.
So which will cause us injuries, issues,
Correct.
whatever.
Correct.
So now, how do you see that in given this, now I can't not be a dentist,
Sure.
right? How do I ensure, or somebody is something else,
Sure.
how do you make sure that you're active through the day? Because our profession doesn't allow, right? Like
Yeah, yeah.
I'm working for 14, 15 hours a
Yeah.
day.
Yeah.
What should I do?
Very simple. Do things that you normally do with your right hand, do it with your left hand. Brush your teeth with your left hand. Wash your face with your left hand. Wear shoes left-handed. Tie your shoelace left with your left hand as a lead hand.
My mom is going to hit me if I
I
start
know.
doing everything with
Yeah.
left hand in
I
India.
didn't say it. I did not.
Actually, I'll tell
Please
you.
edit this section. I didn't say it.
Actually, I'll tell you a fact. I was born left-handed.
Yeah, yeah. My brother was also left inclined.
Yeah, so
Both of you were beaten black
yeah,
and blue to turn right.
exactly.
Yeah.
So, but even now, my natural instinct is my left hand,
Yeah, yeah.
right?
Yeah.
So basically, you're saying use your other hand more.
Yeah.
Okay, what else can we do?
For example, you walk forward. Try walking backward. It does interesting things. You walk predominantly with your shoes. Try walking without shoes.
Mm.
To attain good posture is not humanly impossible. It's the easiest thing to do. It's actually very easy to attain good posture. I have a very simple exercise. Stand against the wall. Your heel has to touch the wall, your bum has to touch the wall, your back of the head has to touch the wall, your shoulder blades have to touch the wall. Stand against the wall for about 30 seconds every hour, or 1 minute every hour. The fact that you do that mindfully every hour is what will tell the mind, oh, this is how I should be standing, is it? Oh, now I feel nice. So the more repeated interactions of, oh, I feel nice you have, automatically you will be more upright. So there is a portion of it which says, yeah, you must have the muscular strength to hold that uprightness. But then a portion of it is also saying there's a motor control system that is saying, oh, I recognize what is poor posture because I have recognized what is good posture. So therefore, let me stand upright for about, say, 10 minutes in a given hour. If I can hold this for 10 minutes in a given hour, I'm only 50 minutes like this, which is better than 60 minutes of this. So in a given 18-hour, 14-hour work day, I add about 2 hours of this posture, about 120 to 140 minutes of this posture. Good, no?
So from what I'm hearing is so that means that there's no ideal sofa, there's no ideal chair.
No.
So what is the right way to sit?
Don't. Yeah, that's the ideal way to sit. Don't. Yeah.
But then you're just coming from Mahakumbh. You
I
are
know.
seeing a lot of people sitting and meditating for hours.
Yeah.
What happens then?
Same. So what happens when you sit cross-legged is your hip is more open. Your pelvic floor is more taut. Whereas if you sit like you and I are sitting, it's nice and soft and floppy, which is what you want. You want a taut pelvic floor.
So is it a good idea to sit cross-legged even on
Yeah,
a
but you
sofa?
can't be sitting cross-legged on a sofa. You can't be sitting cross-legged on a working chair, because the nature of sofa and the nature of chair is to bucket your hip. It's like it holds you.
So why are people not making these changes in furniture?
Number one, it's easy to plonk you that way. It's harder to plonk you here. And remember, any length of sitting isn't so great. The only reason why cross-legged works or even Vajrasan works is because you take away the spinal load, which is why you feel good. Any other sitting, this sitting, sofa sitting, chair sitting, doesn't take that away. In fact, your spine is more compressed when you're sitting and less compressed when you're lying down, less compressed when you're standing. So the least compressed spine position is lying down. And the next best thing is standing. And the worst thing you can do for the spine is to sit.
Oh. So it's good to be sleeping always.
To be sleeping always. You will grow tall.
Okay. Now, sleeping. What is the best way to sleep?
Whichever sleep pattern that gives you sleep.
And what floor?
Anything firm is good. Too much soft is not good because you just sink into it. And your spine doesn't like this unstable surface. So anything hard is good. Floor is good. Hard mattresses are good. Yoga mat is good.
So, what happens to people who teach yoga, people who teach exercises, people like you who are in the profession? It's nice on one side that you are all moving, but too much of movement, is that also bad? Like,
Sure.
is
Sure
that
it
going to
is. Of
cause?
course. Of course it's going to cause. That's just wear and tear on the system. You would like it to be interspersed with rest and recovery. Even for people who just sit for long hours. For example, I come back to IT guys, or I come back to police, or I come back to even doctors who perform their duty in a particular fashion, but they don't get enough recovery time because they're called in for an emergency, or they're called in for work, or they just don't have enough time to rest. That of course affects. Even their non-physical activity will affect, predominantly because, not so much because of posture, but just lack of rest. So you need a good quality of rest to supplement having good posture, or not even having good posture, but good rest certainly helps. Hydration helps these days, because I find more and more people are not necessarily hydrating well enough. Drinking 3 liters in 4 goes is not as good as drinking 3 liters in 30 sips, which is spread through the day. I can gulp, what is that? This is about 200 ml. If I can gulp this every hour, I'll be more hydrated than drinking 4 liters now and not drinking through the day. I think the fact that we aren't moving enough isn't necessarily engaging us with thirst enough. So we don't drink enough because we don't move enough. And it just has a cascading effect
On our overall health as
on
well.
overall health, on digestion, on salivary production, on feeling of wellness, infection, dehydration,
Cardiac health.
inflammation, cardiac health. I think it's just seeping into too many aspects of our overall health. So you are constantly firefighting. And if you open up too many battlefronts, you are bound to lose.
So, what would you advise any one of us on when should you seek help? Like, when is it that somebody who's functional, who may not even have any pain or anything, but we see so many people who are functioning with probably some sort of imbalance, probably some sort of uh, wrong posture which is grossly visible, but they're all functioning. I do notice a lot of people who are either stooping to one side, or their neck is
Sure.
uh,
Sure.
ahead,
Sure.
or they sit like this. So how should one recognize that somebody requires help, and is truly help necessary, or this is a self correctable issue, or how
I
does
think
one?
many of these things are self-correctable provided you know what to correct. Addressing the cause is more important than addressing the symptom. Just because the neck is here or I can't turn fully on the right, me exercising the neck to turn fully on the right is not going to get me full right rotation. I could very well have a left molar issue or a right molar issue, which is not allowing me to turn. I could very well have a poor pelvic floor, which is not allowing the ribs to expand. Addressing those causation issues are more important than addressing, oh, can I turn my neck to the right? Let me massage my right neck more.
That's what we all tend to do, I think.
That's what we all tend to do. Yeah. I think we are all very symptom driven. The less we are of symptom driven, the easier it is to find. Solutions aren't so difficult. Really is not that difficult.
But it's also true that as professionals in health care and wellness, we are also uh, somewhere treating only what patients are complaining of.
Sure.
And that's, to me, is the key difference between the way you're practicing and somebody else. Because what you mentioned was absolutely right, that I go with a neck pain, and the whole focus of the healthcare provider at that point is just that, but they're not looking at what is the root cause of this. And that is a game changer. But unfortunately, it is whether you go on the internet and read, whether
Sure.
you go and meet
Sure,
people.
sure.
So there's a huge a vacuum of that knowledge, which leads to a lack of approach to patient care. And that is why I feel that diseases are only increasing, people suffering is only increasing, though healthcare facilities and providers are increasing.
Yeah.
Right.
Yes.
So are you doing something to address this gap? Like, are you trying to coach people? Are you open to mentoring people?
We have a mentorship program that is open to people who can come in and take or become a mentee. Is that right?
Yeah.
Yeah. The idea is to engage them with a different thought process. How do I think of a problem? Do I see it as a pathology, or do I see it as a possibility? What questions should I ask or can I ask? I think when a person walks in, a client walks in, or a patient walks in, we're too much in a hurry to solve their problem. I don't think we sit back and appreciate the person carrying the problem. I think we owe it to them to understand them first, not the problem first.
Actually, very true. I was sitting with this thought yesterday that, and I shared it with some of my colleagues, is we are all probably misdirected as healthcare professionals because we've been told we will go to a medical school, right? A dental school.
Tell me,
Or
why did dentistry get off medical college?
has a sad part actually, because we kind of got divorced from mainstream medicine, and then we are all kind of uh, singled out.
It's like removing the head from the body.
Yeah. And the unfortunate reality is that oral health has such huge significance when it comes to your general health, because one of the most leading causes of every mess in your body starts from your mouth.
Yes, including posture, by the way.
Okay. Yeah. Right. Obviously, if you don't
Yeah.
have your teeth aligned, then that's going to affect.
Forget that. I was just thinking on the way here, and I was driving from home to here. I was thinking, when a baby starts to walk or stand up, you know what age that is? Around about 1. Something interesting happens around 1. They also get speech. As raw a speech as they get speech. Why? Because the vocal cords descend and you get a cervical curvature.
Mm.
Such a significant role in our lives at age 1 gives you the ability to stand, gives you the ability to walk, gives you the ability to run. And yet we don't consider that to be the area to look at when we are correcting stance, walk, run.
Oh, yeah, absolutely.
It's very interesting.
Totally. I feel the solution for all of this will change, or the approach to healthcare will change when we start recognizing that there is a need for human skills beyond just your procedural skills.
Sure.
And when will we get human skills? The more we keep talking about it, it's not going to change, because what are you joining medicine for?
Sure.
Right? Healthcare. Look at the terms that we're using. Healthcare. Right? So the moment you look at healthcare, it's a distorted term to me.
Yeah. It's a disease care.
Right? So you're forgetting the human component there. You're trying to do a procedure on a person or to cure a particular disease.
Correct.
And disease is not the person. Right? Similarly, now you have created technology and you have created so many gizmos where youngsters who are wanting to join medicine are wanting to join medicine to use those gizmos and do those procedures, right?
Correct.
But go and ask any human being on earth, does he want any procedure to be done? Not even the person who is doing it as a doctor wants to get those procedures done on himself. But you're seeing there is so much being done. I feel the flip will happen the moment we change this from health care to human care, right? Simply changing the term from human care, from this health care, medical care,
Sure.
all of that to human care. Imagine a world where we have somebody saying that I'm going to study human care instead of saying I'm going to study medicine, right? Or dentistry. So I'm going to study human care. And I am a human care provider for oral health,
Yep.
right?
Correct.
Or for
Sure.
bone issues.
Sure.
So then your human element comes first,
Yep.
and then comes your science of sorting out an issue that a patient has,
No, you're right. You're right.
right?
You look at human movement science and look at sports science.
Hmm.
They're both sciences. And they're both in the same space of enhancing movement, uh, rehabilitating movement. But they both do very different approaches. Very different approaches.
Exactly. You're absolutely right. So imagine you have studied human movement science, right? And it does not limit to you understanding human movement biomechanics,
Correct.
but your understanding, just starting with that term, that you're understanding human movement biomechanics,
Correct.
automatically leads us to therapies that can
Sure.
improve issues that are arising
Absolutely.
out of that.
Absolutely.
And that is what should flip in medical care. Otherwise, we're going to have a generation of people who are just suffering, and we'll keep doing acute firefighting. The unfortunate reality, or the burden that uh, people with this approach will carry, is that on one side, where you will feel that you're standing out very unique, only a few will understand that. There is a larger population who will go take 4 opinions. It's the same with dentistry. That, I have a toothache here, and then I want to sort that out. So you go seek 4 opinions, and all 4 doctors will give you the same treatment line. But if there is somebody who will say, look, I understand that this is there, but let's understand why this has happened. This has happened because of something else, and let's go ahead and
Sure.
correct that so that you don't land up with this. Then a great percentage of people appreciate that, but it's still not sinking into a lot of people, because they feel more number of people saying one thing is believable than somebody else saying something different.
Partly that's true. Partly also, I think people want a more immediate solution. I have known of people who, after having explained the causation, uh, are unwilling to spend that time and effort. And that's perfectly fine. Who am I to say you should do it my way? And that's perfectly fine. But there is something to be said for, yeah, I want to find an immediate solution. I don't want this roundabout solution, even though that's the right approach. That approach takes time. I think people weigh that and make that judgment call. And also, people honestly weigh how much time can I actually commit. For example, if I were to ask you to do 1 minute of standing against the wall, 40 minutes of backward walk, that is 20 minutes in the morning, 20 minutes in the evening, um, and screw your happiness by asking you to brush your teeth with your left hand. Um, Now, at some point, there's only so much that you will do, and you'll say, Badri, chuck it. This standing against the wall, I'll look like a dumb nut. Walking backwards, I'll look like I'm escaping from Nimhans. Let me just brush my teeth with my left hand early in the morning where no one sees. It'll be a mess, but at least I'll get some kick out of it. So, I mean, you have only taken part of the solution, but if that works for you, I suppose that works for you. There is that. As much as you would like to see a large percentage of people look at the process rather than the result, I think you will find a few of them not so keen on the process. I think they just want a quick fix. Sad but true. Will it solve the problem? No. Will they come back again? True. But that too is their choice, I suppose.
Yeah. I think, yeah, it's important for healthcare professionals also to spend some time reflecting beyond just their needs, because it's also being driven that way, right? Like if I go to 5 people
Sure.
who will all say that, no, 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 I think you should address the root cause, then automatically that becomes the norm,
Sure. Sure.
right? Just look at cars and their services, right? Previously, the concept of you sending your car for a service regularly didn't exist. There were people who would do everything in their homes,
True.
right, and send it to any sort of garage and stuff like that. But now today there's a whole system put in place. And so the entire car service industry is working one particular way, right, which also affects your sale. In case you're wanting to sell your car, there's a history that is there, and so your price points that you will get at a later date is well defined. Unfortunately, for the most important aspect of life, which is health or wellness, this approach is seriously lacking. And a lot of it has to be blamed not to health professionals, because unfortunately, health professionals are just following what's being taught to them, right? And however much I and you sitting on this sofa will want to change things, it is not going to happen, because our system of education is coming that way. So unless something changes at the ground level there, this is not going to make huge benefits to
I would
patients.
actually say this. Any practitioner who practices with people, a doctor, even a mechanic, doesn't matter, whoever who interacts with people, I think must have a working philosophy. What is their philosophy of practice? And I think if they can stay true to that philosophy of practice, I think their practice is going to be a lot better, and they always have a chance of tweaking their practice enough to fulfill their own goals and ambitions. And their own approach now becomes better because you're always tweaking the principle of philosophy.
Absolutely, very well said.
And that's important. I think all practitioners should have a philosophical statement.
Absolutely. Absolutely. And when you have that philosophy, your approach is guided by that
Correct.
philosophy. And you're constantly improving
Correct.
because there is so much to do when we
Correct.
go ahead thinking
Absolutely.
about how can I do this
Absolutely.
better.
Absolutely.
Yeah, great. So, any broad tips to people who are watching this on what are the 5 things that they must do?
For good posture, very simple. Stand against the wall. Your heel has to touch, your calf has to touch, your bum has to touch, your 2 shoulder blades have to touch, your back of the head has to touch the wall. So, as close and as straight as possible, you stand against the wall. And breathe, normally breathe without disengaging any of these parts. That's about a minute every hour if you can do. In a given day, you will do it about 14 times. You have done about 14 minutes of correcting or making your body aware of what is a good posture. That's a good start. Second thing I'd ask people to do is walk backwards, preferably bare feet. Walking backwards generally helps with good posture because you're using the back musculature. So you will straighten up. The third thing I would say is do as many different big, small, unique activities with your left hand versus your right hand. So you rewrite some of your motor cortex's movement patterns and you balance them out. And interestingly enough, you'll also add a little activity of mindfulness. It's very easy to brush your teeth with your right hand because you've always brushed your teeth, but it's very difficult to brush your teeth with your left hand because you have never done it. So you will obviously miss a tooth and it doesn't synchronize. The arm movements don't synchronize. Then you will begin to move the head around the brush. So as frustrating as that is, you will gain better control. And because of that activity of mindfulness, what was brushing your teeth? 2 minutes. Because of that activity, many things change. So I would add that. Do small things with your non-dominant side. The fourth thing I would say is see far. We see where children today don't see far. They don't see the horizon. Where is the horizon?
There's apartment.
This is the apartment. Correct. That is the horizon, which is 80 feet away from you. I think kids, because your eyes don't see far, your body then determines itself to work in closer and closer proximity. And therefore, you don't have extension. So, seeing far is important. Hydration is another thing. I just think we don't drink enough water. Correct. I think we think tea and coffee is water. It's not. Nimbu pani is not water. Water is water. So hydration is important. I would add 6. Sleep is what I would add as an important criteria, an important component in good posture. If you don't rest well, your muscles aren't rested. Therefore, your subsequent postures will be burdened by the subsequent ones, which was the day before ones, which will affect your posture. I would say if these 5, 6 things would be the prima facie most important thing to do. Then if you have time and space, swimming helps, going to the gym helps, running helps, climbing stairs help, getting the jaws to sit better helps. Oh, seventh thing, have good sex. That helps posture. It helps posture. The fact that you have kept the penis erect, the fact that the woman has orgasmed, works the pelvic floor muscle. And if you work the pelvic floor muscles, the whole pelvis sits better. And what's above the pelvis? Your spine. What's below the pelvis? Your hip. If both of them can sit because the pelvis is sitting better, you have all the more reasons to have better posture naturally. I don't think we are having enough sex. I know for a fact that people are not having enough sex because I seem to ask that question in my consult. And I'm sad to say that people aren't.
Yes.
So I would say those 7 things. Then comes the gym, the running, blah blah blah. I think if you can do these 7 things, I think you're more than better posture.
And what is your opinion about all these gyms and so many crazy different types of exercises that have come through? What's your opinion? Are they required? Is it mandated that all of us have to go to the gym? It's like a fad.
Not at all.
Weightlifting, weight training.
You don't need gyms for such thing at all. You have your body and you carry the weight that you carry.
Good enough.
That's more than good enough.
What would you rate swimming as?
Up there, dude. Up there. If there is one activity that you can do, that would be the activity. Simply. Yeah. Close your eyes. If you have access to a pool, think as if you have gotten a little drop of a nectar. It's that good. Swimming is highly resistive because water is denser than air. So therefore, you are using muscular effort to swim. Therefore, your muscles will improve. As far as general health is concerned, your insulin uptake becomes better. Because swimming is an aerobic activity and water is more denser than air and it pushes the ribs into the lungs because of its density. You're inhaling better because you're exhaling better and more in swimming than when you're running. So therefore, your inhaling quality becomes better. And because swimming is opposition, that is, you use your right hand and left leg to kick and left hand, right leg to kick. It's cross patterned, which is how your brain sees, which is how you see, which is how your fascia is put together. The colder, the better the water.
I was encouraged until now because I go to a temperature controlled pool.
Yeah.
Okay.
I'd kind of pricked your bubble, didn't it?
Huh.
Colder, the better.
Okay.
Because water becomes more dense in cold. So you have to actually put in more effort. Not only that, cold water tends to reduce inflammation in the body. So you actually feel better because there is lower inflammatory receptors available. Oxygenation becomes better because you shiver. Cold baths are good, especially like ice baths are good. So I would say do those. Do the basic things first.
And how much time should somebody swim?
Anywhere between Half an hour to an hour.
Recreational.
Yeah, yeah.
And any stroke.
Any stroke, any stroke. If you can stay in water for about an hour, I think you have done.
Awesome. So hopefully we'll do a series of uh, conversations on the kind of work that you do, because personally I've found fabulous results coming out of not just my own personal
So,
need that I have approached you for several years. I've always found your approach to be completely uh, different is a wrong word to use, but uh, great, because I think you've always addressed. I remember how once you asked me a question when I spoke about a shoulder pain or a back pain that I met you for, and your interview where you asked me about what I was going through in life, and what about my diet and what did I eat, the happiness quotient about life, and that's so very important uh, as a healthcare provider, to look at life in a 360-degree view, which fundamentally helps healing and not a fragment that we are approached to. It was lovely, mate, to have you here.
thanks,
And
man. Thank you.
have this, and hopefully we'll do more of these
Like that.
as an ongoing.
I'd like that.
Yes.
Thank you.
Thank you.
That was good fun.
Same, yeah.